The IMVOKE PBM whole-body hyperthermia is the world's first convergence-type whole-body hyperthermia that combines far-infrared rays and near-infrared rays to promote chemical and biological metabolism, blood circulation, cell regeneration, and excretion of toxins through light irradiation that combines near-infrared and far-infrared rays. Hippocrates said, "What drugs will not cure the knife will. What the knife will not cure the cautery will. What the cautery will not cure must be considered incurable." This painting is the work of an artist named Wilhelm Busch and shows the hyperthermia was being performed 170 years ago. However, for the past 2,000 years, Greek people have been treating many diseases with heat when they could not be cured. Methods for raising core temperature include active hyperthermia, which involves injecting drugs, and passive hyperthermia, which directly injects heat from the outside. Passive hyperthermia is divided into local hyperthermia and whole-body hyperthermia. Local hyperthermia is effective when combined with chemotherapy or radiation therapy using frequency, ultrasound, micro-ultrasound, or ultra-high-frequency devices. Whole-body hyperthermia developed when Dr. Arden of Germany, who first invented television and electron microscopes, developed a whole-body hyperthermia device in 1987. A whole-body hyperthermia heats the blood using infrared rays A, which can pass through the skin layer without burning the patient. As the blood temperature rises, patient's whole-body temperature also rises. After, Dr. Arden developed Eratherm, Haeckel, and Dr. Onco detox chamber were released. However, the IMVOKE PBM whole-body hyperthermia has been studied due to the short durability issues with halogen lamps for the purpose of clinical use of an easy-to-use whole-body hyperthermia. In cancer treatment, hyperthermia was developed by Dr. Hager, a pioneer in integrative medicine. Dr. Hager developed an integrative medical cancer treatment concept that combines hyperthermia, chemotherapy, and biomedical treatments based on the clinical results that cancer can never be cured with only one specific treatment method.
Cancer patients have a lower body temperature compared to normal people, and aggressive treatments such as chemotherapy and radiation therapy destroy blood vessel cells and reduce blood flow and metabolism. Therefore, whole-body hyperthermia is deeply required to raise the core temperature of cancer patients from 39 to 40 degrees.
In cancer treatment, the combination of hyperthermia promotes blood circulation, supplies intracellular nutrients and oxygen, and increases the influx of anti-cancer drugs and biological agents into cancer cells, leading to direct destruction of cancer cells. In addition, it increases the phagocytosis of NK cells and macrophages and activates the discharge of metabolites, thereby promoting detoxification function, muscle relaxation, and mental stability. PBM has been used as a key keyword for future treatment methods by the National Institutes of Health (MESH) since 2016. PBM is an abbreviation for photobiomodulation therapy, when human tissue is irradiated with a light source of appropriate intensity based on visible light in a specific wavelength range and near-infrared light. Nitric oxide is generated in intracellular mitochondria. As a result, blood vessels expand, capillaries are regenerated due to increased blood flow, and the supply of nutrients and oxygen to cells becomes smooth, thereby promoting cell regeneration. The IMVOKE PBM whole-body hyperthermia combines NASA's research results showing that near-infrared wavelengths penetrate deeply into the human body. LED light sources of various wavelengths used for treatment purposes have been modularized, and LED near-infrared light penetrates deeply into the skin to generate nitric oxide, activating blood circulation and cell regeneration. In addition, it is the world's first convergence-type whole-body hyperthermia that combines far-infrared rays and near-infrared rays. By combining in a light heating network with far-infrared radiation energy, equal to the wavelength of the human body. IMVOKE PBM Wholebody Hyperthermia uses a light source of a specific spectrum emitted from the LED near-infrared rays. Through the process of penetrating deep into human tissue and inducing photophysical and photochemical effects in intracellular mitochondria. It is IMVOKE PBM Wholebody Hyperthermia that can improve the treatment effect and quality of life of cancer patients by increasing the effectiveness of anti-cancer drugs and biological agents, reducing inflammation and pain, reducing mucous membrane damage and nerve damage, and helping wound healing.